Welcome to the Augusto Health IT podcast, where we talk to industry leaders about their vision for software design and development, mobile and cloud in healthcare. I'm your host, Brian Anderson, CEO of Augusto Health IT. There's a lot to cover here, so let's get started. Welcome to the Augusto Health IT Digital Insights podcast. This episode is part of our healthcare focus. We highlight innovators who are changing healthcare for the better. This episode's guest is Nathan Baar. He's the founder of HealthBar. HealthBar offers custom healthcare services provided by skilled technicians wherever you need them. They're changing the way healthcare is consumed, one service at a time. Welcome to the podcast, Nathan.
Thanks, Brian. Glad to be here.
It's been really fun watching HealthBar grow, and I think it's really a reflection on the history, your history, and kind of where you came from, and how you came up with some of these ideas and put them into action. Maybe could we talk a little bit about your history? Didn't you grow up on a farm?
Yeah, out in the country down in Allegan. Definitely had some good time growing up baling hay and taking care of some horses and yeah, no, I think it taught me hard work and dedication and determination from an early age. But yeah, no, I think kind of getting into the service industry, worked in a grocery store as well, and found out that I really liked interacting with people a lot. Just that level of personal interaction and conversation. So my mom saw that. She was a nurse's aide and said, "Hey, you might really like the medical field." So graduated from high school, got my CNA license, just a quick little degree, and started working at a nursing home and found out that I did. I love taking care of people. I love just the interaction, really that caring and empathy side of it, which led me to get my nursing degree from Calvin College here in Grand Rapids. And then started my nursing career in the emergency department shortly after that.
And what was that experience like? It seems like a really quick progression, but that took some time. Mm-hmm. And what was it like, starting, as an entry level and then kind of working your way into this larger organization and leading parts of that nursing team in a larger organization?
Yeah, one of the things they don't tell you when you start working in the emergency department is just the challenges that it presents. A lot of people see the ER and they think of all the high energy, high rush things, which there's plenty of, but you also see a lot of the dysfunction that exists within healthcare. You see a lot of the failed cases, the chronic diseases, the just unmanaged, health of all these individuals, and how the ER is used as an access point for a lot of very basic needs. So one of the things that I saw at the bedside were those. I'm talking to patients, I'm hearing about their issues. There's so much frustration that exists, and having that all kind of mull around in my head, I found that I had kind of a natural inclination to leadership. It's that people factor again. I just really liked, talking with patients, but also fellow clinicians, and it just kind of naturally gravitated towards leadership. So, started getting some entry level positions in leadership. Really was able to excel at that, found that it was a really good match, still heavily focused on clinical care, but then also got the components of leadership. Had additional opportunities presented that I was able to get until finally getting to my last position before starting HealthBar as the director of emergency and urgent care services for Metro Health, which really, that experience when you get to that level, and still having that clinical background and working bedside a little bit, I mean, it truly put two and two together with I'm seeing the core operations of how everything works from the legal side to the HR side, finance, and really, kind of knitting, that narrative of the dysfunction of healthcare and seeing it firsthand.
Yeah. What were some of the things that started to kind of give you the seeds of these ideas that you're applying to HealthBar now?
A lot of it was inappropriate utilization of our services. It was in hearing those direct patient stories. It was hearing people of, saying, I can't get into my doctor for 3 months, or, I don't want to use health services because I'm worried about how much it's going to cost me. I just don't know, what that bill's going to be. or, well, I was thinking about doing this, but I just didn't have, the information. I Googled something. They just didn't have a good source of information to go to. There was not that, trusted advisor side. So a lot of those different conversations and realizations kind of led to this thought process forming in my head of, why can't we make healthcare more accessible? Why can't it be delivered in a transparent way? Why does it have to be so complex? What are we doing all of this for? All this documentation and all this insurance related work. It was a lot of busy work that didn't really provide better patient care. All it did was check boxes and provide data, which there's important, aspects to data, but it was taking over our clinical lives. As clinicians, we get into healthcare because we want to help people, and it felt like we were becoming data entry specialists and not being able to, perform the work we wanted to do.
Yeah, it's interesting. You're kind of touching on the price transparency issues in healthcare, right? Like it is kind of a mystery, if you wanted to go get a health service or even a surgery or something like that, it's really unclear a lot of times uh, how much it's going to cost, and it prevents people from taking advantage of the services that they need. It's interesting, like, so you saw that, like, what were the very beginnings of HealthBar? Like, what did you do to get that off the ground?
Yeah, I mean, knowing that healthcare is obviously a very complex system and how there have been a lot of attempts to disrupt it. Honestly, I think a lot of things is timing related, and having this idea for a service delivery model that mobilizes a clinical workforce and provides them with the opportunity to provide services outside of a hospital's four walls. First and foremost was one of the core components of it, and seeing how the pandemic truly was transforming how we interact as a society and how clinical care is provided. You started seeing a lot more of this mobilization factor with health services because they were needed. And so really saw that, and it's like, here is truly an opportunity to mobilize clinicians in a meaningful way, for testing or other, clinical support services in the business environment. That was truly the first kind of moments where the model started to make a lot of sense. Was all right, here is a legitimate opportunity. So yeah, that was kind of step one, was that, kind of these next steps as the business continues to evolve is providing these clinical services in a more um, simplistic way, but beyond just testing, and these other clinical supports, it's more advanced care.
Yeah, it's interesting, and it's interesting how you mobilize teams. It kind of like the whole trend towards the gig economy, and just the nature of how healthcare workers are scheduled in hospitals and healthcare organizations. Like they don't work like standard hours, right? So they have sometimes time on their hands that can be utilized differently. Maybe you could speak to some of that too.
Yeah, one of those things for me as a clinician, I work three 12-hour shifts. It's pretty standard for a nurse, is that you have 12-hour shifts. It's days or nights or some mix of that. But I had 4 days off a week, and really, it's what am I going to do with that time? People will take time off and spend time with their families, but even then, 4 days off a week is a lot. So, kind of taking that personal experience and thought and saying, well, are other clinicians thinking the same thing? Which they definitely are, and providing an opportunity for these clinicians to work and utilize that free time in a way that empowers them to create their own schedule and to use their skills and talents, in a larger scale, really community impacting, and yeah, it's been an awesome thing. But yeah, we've been able to mobilize a very large workforce, in a employed and contractor model.
Yeah, that's interesting. And maybe tell the audience about some of the types of services that you offer and some of the ways you deliver it.
Early on, pandemic related and through 2020, a lot of it was testing and screening services. So we started out by supporting businesses, institutions, extended care facilities, schools with our testing and clinical services. So really, it's having a clinician on site at a place of business, at a school, or in an extended care facility, and providing those different clinical services distributed across the state. I mean, logistically very complex, and but with the right tools in place, makes for the ability to do that.
Yeah, and when you say the right tools, what do you mean?
Technology. We live in a day where technology is key. It's one of those things where, phone calls and emails only, do a certain amount from an extent standpoint. So we started seeing the need as our team continued to grow and as we grab more contracts to really start utilizing some higher levels of tech. So it was, what are some more advanced communication platforms? What are some, pieces of scheduling software? How do we, timekeeping and gathering some data to go along with that? You start layering in these different tools, but each of them has their limitations and barriers.
Yeah, and it's like you've got a mix between some of that's custom and in your vision of how you want the experience to be for customers and patients and your clinicians and part of that's off the shelf software and things like that. Like it's a and then also like I think some of the models that you're using for delivery, like you said, you're using contracts to connect with companies and putting people in those locations at times when they need to be there. But you've also got like drive-throughs and stuff. Maybe you could talk about some of those models.
Yeah, the concierge component of it is one, one of our big service points where, we want to go out to individuals and provide the service where they are. We also understand that people sometimes want to come to us for services. So we've continuing to try to flip the script on what traditional healthcare has provided. We wanted to provide a drive-through medical service where someone doesn't have to get out of their vehicle to receive medical services. So they come up to us in our drive-through locations. These are old bank buildings, and stay in your vehicle. You use a QR code to register for your service and provide your information. You order your service like you're ordering off of a menu, and then a clinician comes out to your vehicle and completes that service. So very simplistic in nature, but also extremely effective, and it removes a lot of that waste that exists within healthcare.
I think you had this really interesting inflection point with these ideas because the pandemic hit, and where a lot of people were, you know, uh, going into their homes and using technology and stuff and disrupting the way that the system really kind of was forcing people to interact with it. You took that as an inflection point and created something that kind of matched up with the new reality, right?
Yeah, there's timings. I mean, a lot of things, timing is everything. And it truly was one of those situations where I think there's been a lot of thought, by a lot of people within healthcare to say there's got to be a better way. Cost is going up, outcomes are getting worse. People aren't living longer, yet we're still perpetuating a system that hasn't been effective. And I think truly understanding why it's not effective and what the barriers are. I think that's what the kind of that clicking point was is I was able to see some of those barriers firsthand, both from the administrative side, but then also from the patient side, and then that clinician component of it. And then yeah, the pandemic, it was like a clicking point of, all right, here's that into a system that is so entrenched, but here's a spot where telehealth's starting to take off, and these services within your home and distributed medical care, it's all progressing, and that's truly the moment where everything kind of clicked.
Yeah, it's interesting because like even like before the pandemic, if I recall correctly, the insurance providers wouldn't pay for a telehealth call. You had the only things they would reimburse for were actually in person things, right?
Yeah.
Which seems so crazy now after going through this pandemic, you know?
Yeah, no, the digital space is flourishing, and I think it's great that it's getting some of the justice it is. Healthcare is very complex, and a lot of that, entrenchment from the insurance industry and everything else was, jaded against telehealth because some of its limitations. But the pandemic truly, sh- you know, kind of bore out what the value of telehealth is. It's not a catch-all. It doesn't solve every problem, but it's another access point, and it's another conversation, and it's another, moment to educate an individual or check in on them. That's simple and easy, and that's one of the core concepts with Health Bar is healthcare has been made to be so complex. And it's like it doesn't have to be. We're boil it down to its most basic components, and it's clinicians taking care of people and helping them.
Yeah, yeah, I follow what you're saying, man. It's like I have parents, they're aging now, and it's watching how they interact with the health system. I mean, they're going to appointments a lot, and I
Hmm.
really think like there's a lot of times where they don't need to be in person. What they
Hmm.
really need to do is give an update of how they're feeling or what they're experiencing, and then they can decide if the next step is to go meet in person, because that takes a drive, it takes parking somewhere, it takes going in, it takes waiting, and you're even providing a more streamlined experience for services that just speed the whole process up, make it more accessible for people.
There's so much waste that exists. If you think about all the systems that are in place, to check the boxes to grab this piece of documentation, why does it have to be in person, or why do you have to get out of your vehicle for a blood draw? These are things where people have just followed tradition for so long, and it truly is, like I said, boiling it down again to its most basic functions. It's a clinician assessing and interacting with a patient, and taking really all the complexities of everything in between, and just saying, how do we make it so simple that somebody won't hesitate to use our services, because there's no other thought in it. There's no surprises. There's no complexities to it. It's a very consumeristic model.
Yeah, the other thing I think is interesting, like some of the services that you offer, you make it clear to people what the options are. Like if
Hmm.
you wanted to do a COVID antibody test, you've got different options that people can choose from.
Yeah.
Whereas like a lot of times the doctor would just order that and they would tell you, like
Hmm.
I think one of the interesting ones you guys are doing is the immunity strength.
The Aditex score. Yeah. Yeah, and that's again, you spoke to it, options and education. We want to have the individuals using our services be informed. We want to empower them to take control of their own health journeys. We firmly believe that a well-informed consumer of healthcare services is going to make significantly better choices and take better care of themselves. And so, yeah, we have a couple different options for COVID testing if it's immunity testing. One of the great products we had was the Aditex score that we just brought on, and it's a great piece of information to tell somebody how immune they are to COVID, which may inform future decisions. This is something again that's empowering, that is pertinent information, and that's what we're about, is saying, how do we empower our patients to take better care of themselves and make more informed decisions.
Yeah, yeah, it's innovative and it's cool. What are you excited about? What's your vision? Where's it going?
I mean, that's almost the hard part with healthcare is there's so many shiny objects. Really, the vision though, and what we're staying focused on is creating this new delivery network for healthcare. To say there's another way. You have your traditional structures, hospitals and outpatient offices and emergency departments. Um, but once you leave that as a patient, where do you go? You go home, and who's there to help you in that space? There's nobody that's intentionally helping you. And so we want to create a healthcare system that is really wrapped around and focused around that component of life. We don't want you to just interact with healthcare when you're sick. That's what the system's based off of illness. You go see your doctor when you have questions because you're not feeling good, or certain things. We want individuals to be proactive about their health, engage in certain health promotion and wellness activities because they know it's good for them, and they understood, where their current needs are. We want to be that simple access point where it's as easy as going to a drive-through, for McDonald's to receive healthcare. It's so simplistic and easy, but existing outside of the insurance industry, so we can keep everything fully transparent, and we can control pricing to a point where it fits that consumer model.
Yeah, well, I think you're doing great things, Nathan, and the growth of the business so far has been impressive, and I think, it shows that it's really needed. And I'm excited for you. We're excited to be working with you on different initiatives, and really appreciate what you're doing for our community and for healthcare, man.
Yeah, really appreciate it. Like I said, yeah, quick plug for Augusto. You guys are amazing partners and awesome to be working with. Custom piece of software that's really helping that mobilization of our workforce. Understanding we live in a digital world now, and our goal is to create these care networks, not just in West Michigan, but across the state and across the country. And technology is going to be a significant part of that. And so, yeah, you really can't operate right now without being a sliver of a tech company too. So we feel like that's a growing part of our business, and yeah, happy to be working on the projects together.
Super interesting what you could do if you just think outside the box, and you guys are definitely doing it. So I just want to thank you for your time being on the interview, and really appreciate the work you're doing, Nathan. Thank you. Hey, thanks for listening to the Augusto Health IT podcast. Augusto Health IT is a custom software design and development company with a focus on healthcare. If we can help you on your next project, or you just want to say hello, contact me today by calling 616-427-1914 or visit www.augustohealthit.com. Remember, you can always find this podcast on iTunes, Spotify, Google, and YouTube.